Hi, everybody. Welcome. This is great. Ooh, I think I see, oh, what's happening? Hi, everybody. My name is Stacy Steele, and I am the, hey, Kevin. My name is Stacy Steele, and I am the marketing and communications director here at Charity Navigator. Hi, I see people joining. This is fantastic. This is actually my first Instagram Live, so let's see how this works. Oh, I see a lot of people joining us. Hey, Kevin Scally, I see you. Hey. Oh, hey, okay, so tonight we have something really, really special. We are in the last round of 4 live streams that we've had today, and tonight we have something very special. It is 6 o'clock here in New York City, but it's 3 p.m. out on the West Coast. And tonight we have the Black AIDS Institute as our guest. So wait, give me 1 second. I'm gonna have them join us. Let's see how this works. Trying to see if I can get them. Here we go. Hey!
You did it!
Pressing buttons.
It's hard. It's very difficult.
It is very difficult. I'm not used to all this technology. No, this is hilarious because I'm so used to Facebook Live. So Instagram was like a whole other, like, where am I? I'm lost.
Yeah, so, I did my first IG Live a couple weeks ago, and it worked out okay, but it was a little nerve-wracking, so I'm on the same page with you.
Okay, good. Whew. Well, we made it. How are you?
We did. Good. It's a busy day. It's World AIDS Day. It's Giving Tuesday. Yes, but it feels good. It's a beautiful time to be receiving support and to really be lifting up the work of HIV and how HIV has impacted so many folks.
I know. Today, it has been, obviously it's 6 o'clock here in New York. So we've been pretty much going since around 7:30, 8 o'clock this morning. And obviously we're still not done, but it's been all good. You're like the 4th live stream of the day. You're just going to bring it all together.
How are you feeling?
I'm here for this. And then we had 3 others earlier. We had Giving Tuesday, the organization, this morning, and then we had UNICEF USA, which was phenomenal, and then we had DonorsChoose, and now it's you. So
yes, I'm closing it out.
Yeah, listen, this is great because we're going to be able to talk about the Black AIDS Institute. For those who are unfamiliar with the Black AIDS Institute, we're going to talk about World AIDS Day. We're going to talk about Giving Tuesday. We're going to talk about community, whatever it is that we can throw in to get people excited, because listen, it's only 3 o'clock on the West Coast. People, you still have time to give, to support your nonprofits, including the Black AIDS Institute. So yeah, let's get started. All right. So what have you been up to all day? What's going on at the Black AIDS Institute today?
So many different things. The Black AIDS Institute, our mission is to end the AIDS epidemic, and we do that by engaging Black institutions, Black leaders, and individuals to confront HIV. So it's a pretty big mission. It is. And we do work across the country, as well as where we're headquartered in Los Angeles. We provide direct HIV services. And so we've had lots of speaking engagements that hopefully folks will be seeing. I'm really trying to raise awareness. World AIDS Day is the largest commemoration across the globe, really kind of commemorating the impact HIV has had, and really commemorating the people that we've lost to HIV and AIDS. And so it's an interesting thing to commemorate during COVID, and especially, across the country as we see increasing cases. You know, my text message threads and my emails and phone calls, the number of people that I'm hearing about who are being impacted by COVID, people who are losing their lives to COVID, is increasing as well. And so it's an interesting thing to be in the middle of the biggest pandemic since HIV, and then commemorating HIV at the same time. And so we've been doing a lot of awareness. You know, HIV is so different than it was 20, 30, almost 40 years ago when it first came out. It doesn't have to be the same. It's not the same death sentence that it once was. And so getting people aware of that. We have pre-exposure prophylaxis, PrEP. We have treatment as prevention, and knowing that people who are living with HIV can live long and healthy lives. And when they're undetectable, their viral load is so low, HIV can't be transmitted to other people. This concept of undetectable equals untransmittable. And so that's amazing. And so many folks, particularly Black people, don't know about that. And so making sure that people know about that has been a really kind of big thing for us. And here in Los Angeles, we're back under stay-at-home orders. And so some of the kind of HIV testing and tacos and things that we were trying to figure out and plan, we're trying to kind of modify and think about, you know, because we have to be really mindful of making sure that we keep our community safe and our clients safe while providing these kind of life-saving services. So today has been a microcosm of 2020, a whirlwind, for sure.
Yeah, I know. So talk to me, because you just said something in your commentary, which leads me to believe that, you know, I think there is this feeling that AIDS and HIV is kind of over, or it's cured, and there is a bit of education that's still necessary, especially for younger folks, where they kind of, it's not, okay, so if you go back like 20, 30 years ago, this was something that was on television. We didn't have, you know, social media at the time. And so it was our way of getting the news and the information was probably a little primitive, because we just didn't have the tools that we have today. So what are you doing now that you feel is just like absolutely necessary in order to get the message across?
Yeah, so we do a lot of work with working with Black leaders, Black institutions to really get the word out around HIV and AIDS. I think last week I had an opportunity to speak to Mama Tina, Beyonce and Solange's mom, you know, the Queen Maker. And, you know, she was able to talk about her own experience with HIV and losing a loved one to HIV, and really kind of lifting up this person who's been impacted, person who lost their life, a family member. And then also talk about all these amazing advents that we have, like treatment as prevention and PrEP, and all kinds of amazing HIV testing that we can now do. And so, you know, her lending her platform and her kind of largeness to talk about HIV, really kind of lift up folks that have we've lost, but also say, hey, look at all these kind of amazing things that we know about. And so there's so many Black folks, Black celebrities, Black influencers who are interested and really using their platform and sharing that story. Black media has been a huge part of that. So working with some of our media partners like Essence, and other kind of Black media to make sure that they are putting in stories and talking about and reporting on these new advancements that really many Black people don't know about has been really important to us. And so for us, it's talking to Black folks directly around HIV and AIDS, letting us know, letting our communities know that HIV isn't over. And not only is it not over, but we actually have an opportunity to end HIV within our lifetimes. And so when we think about parents and the loved ones and the family members that we've lost, what better tribute can there be to ending HIV within our lifetimes? And so we have the capacity to do it. It's about, do we have the will? Do we have the resources? Do we have the support? And really being able to talk about HIV, particularly in Black communities, from uniquely and unapologetically Black point of view. The reasons we see high rates of HIV in Black communities is because of, you know, systemic racism and drivers of racism that impact Black communities. And so really being able to respond in a way that speaks to and for Black communities is really important to us, and part of kind of what we do in our effort to try and end HIV.
Yeah, I mean, so I think what is really complicating issues right now is the fact that there is COVID. it is, I mean, it is something that I don't think that we envisioned 9 months into this, we would be where we are. And, you know, I was doing a little bit of reading in preparation for this week. And one of the things that I was looking at was UNAIDS, HIV.gov, and just kind of looking at some of the statistics. And obviously, I was really interested to find out what set, you know, were there any kind of numbers that I could look at in terms of those that were infected, those who are infected with HIV and AIDS here in the US, and where do they fall within like within COVID, and you know, because obviously having HIV or being diagnosed with AIDS is is terrible in and of itself, but then to then run up against COVID, if you are then dealing with that, I mean, how, what have you heard from the street? What have you heard in talking to other, you know, perhaps like people in the medical industry about what's going on with since we are so disproportionately affected, Black and brown folks are so disproportionately affected by COVID. How does that kind of play into like those who are HIV positive or are infected with AIDS?
Yeah, well, first I want to say I see BAI's founder, Phil Wilson, is in the, I don't know what this is called, an Instagram Live, in the room, in the space. We also have our National Director of Programs, Reverend Rob Newells, who's based in Atlanta here. And so they can back me up in the chat as we talk. But yeah, you know, Phil says the lessons of HIV can help tremendously in developing solutions and strategies to confront COVID-19. Mm-hmm. And that is absolutely true. You know, there's many things that HIV has done so well. Mm-hmm. And one of the things that I think has made HIV unique, and why the COVID response is really being placed on the backs of HIV advocates and researchers, because HIV, the movement that happened is that people who are impacted by HIV, people who are living with HIV, were right there with researchers, scientists, pushing the government, pushing researchers to make sure that in the solutions to respond to HIV, they were community centered. And, you know, what we saw with COVID, you know, when COVID first happened, everybody in the field of HIV, I think there wasn't anybody who does public health that didn't say, this is going to disproportionately impact communities of color, right? Yes. Racism really is the driver of health disparities in our country. And any kind of HIV, any kind of health disease we see is almost always impacted and driven by these structural inequities and structural racism. And so before we even had data for COVID-19, we said this is going to greatly impact people who of color more. We also assumed that HIV, people who are living with HIV were going to be more greatly impacted, right? Because it's HIV compromises the immune system. We also see, for example, you know, Black people who are living with HIV are less likely to be virally suppressed. And when you're not virally suppressed, that means HIV is in your body and it is wreaking havoc on your immune system, right? And so we assumed that we would see data that was going to show that COVID was going to have a greater impact on people living with HIV. Some of the initial studies that came out in the spring, maybe like May or June, actually showed there wasn't that much of a difference. But recently, and so we said, well, let's see, wait and see to see kind of what happens. We're pretty sure that people who are immunocompromised are going to have worse health outcomes when it comes to COVID-19. And just recently, over the past few weeks, we now have the data that shows kind of what we thought was going to happen, that people who are living with HIV are more likely to have poorer outcomes when it comes to COVID-19. And so that, you know, is really important. It's something that we're looking into. We also are seeing, though, you know, the number of PrEP prescriptions, so pre-exposure prophylaxis, is this amazing pill that people can take who are HIV negative, and it makes sure that you stay HIV negative. It's just a kind of amazing advancement that we've had, right? Taking a pill a day, kind of like birth control, to prevent HIV acquisition. But we see PrEP prescriptions are down because people aren't going to their doctor. People who are living with
Right.
HIV are not going to their
Yeah.
doctor in the same kind of way because of all of the restrictions in place across the country and the various waves that we're going through. And then, of course, for people who are living with HIV that then have COVID, the outcomes are showing to be worse. And so it's something that we're
Right.
looking at, something to consider, because, we can't, in the middle of one pandemic, forget about another pandemic.
Oh, yes. That's so true. So, but there's hope, right?
There is hope.
We don't want people to feel like, this is at a loss. There were you said something really positive at the very beginning that, we can be successful with this and getting a cure in our lifetimes. We can absolutely do this. And I feel the same way for a lot of other things that are plaguing the health community. So, I mean, I just know that it can be done. I feel it can. I just feel education is still key. I think supporting one another is still key. I think really talking openly about it is key, because I kind of feel that still there is people are reticent about really talking about their status. We're not living in the 1980s anymore, and there's a lot more information out there, and you can really not just survive, but you can really thrive. It doesn't have to be like a death sentence. And we want people to make sure that they're appropriately taking care of themselves. All right, so let's just switch gears a little bit. So talk a little, give me an example of like a program that you guys have worked on recently that really kind of been like, yes, in the age of COVID, we really pulled this off. This was amazing.
There's been a lot. I mean, like you said, around, there's hope. I've felt such high levels of hope and excitement during these times. It's such an interesting experience, 2020, because there's these kind of high highs, but really low lows. But there's been this forced innovation, right? And we've had to reimagine how we do work completely. And so there's so many programs that we've done recently that I feel very proud of. One that I always think about is our Black Treatment Advocate Networks, or BTANs. And so BTANs are kind of the heart of our mobilization work across the country. We have, I think it's over 16 or 17 chapters across the country.
Really?
We have, I think, 15 or 16 affiliates. I think it's like 30 some odd cities that we have BTAN presence in. And our BTAN members, each of our chapters have at least 20 members. Usually the members are people who are living with HIV, people who are affected and impacted by HIV. It's Black people who are part of the HIV workforce. So they work at small aid service and community-based organizations. They may be the Black folks that work at the health department, that really come together and say, we're going to come together as a community of Black folks doing this work in our city to really advance ending HIV in Black America. And they have done such an amazing job pivoting. And so, usually they would meet in person. Oh, yes. Thank you, Rob. 16 BTN chapters and 16 affiliates, and it's growing.
We see you. 16 BTN chapters. And growing.
And so, before they were meeting monthly, they were doing programming in person, lots of in-person events. And so they pivoted. We figured out how to do Zoom meetings. They did like happy hours and all of these events online. And what they were able to do is, because it went from in-person programming to virtual, that really the kind of coalitions that they were developing expanded, right? So they could have people from, the entire state of Florida join a town hall as opposed to having to drive there. They were able to bring in people who weren't already a part of BTN in this kind of virtual age. And so the work that they've done, our BTN chapters were really instrumental and were part of the folks who really mobilized to get the vote out and really making sure that communities understood what we were voting for and how those votes impacted ending HIV in Black communities. And, you know, they did thousands of phone calls and all this kind of work with other voter mobilization efforts to really get the vote out. And so that makes me so proud. And the way that these coalitions were able to pivot, I think is, you know, so amazing. And then I would say the last thing, I have lots of stories, as you can tell, is our LA work. You know, we pivoted and started doing a home HIV testing program. Okay. And so if folks who, you know, don't want to come into the clinic, you know, but we can send you a HIV test kit, and we can do a video conference with you, so we can walk you through all the service, all of the steps needed to do the HIV test, that we can do counseling. And so no matter what the outcome is, that we can provide support to you. And so really pivoting that work virtually, I've been really proud of our team being able to do that while, you know, all of us are being impacted by COVID. The number of people, particularly for us Black folks, and because I have the privilege of working with so many Black people every day, the number of people within our staff, the number of people within our BTAN chapters that are being impacted by HIV, losing loved ones, acquiring COVID themselves, has been tremendous. And so to push through that and continue work towards ending HIV, I think is a testament to how important, how critical this work is.
I want to have, I want to talk about, you know, BAI, the organization, because none of this works happens just by magic, right? Because as nonprofits, I think sometimes donors don't realize just how much time, work, and effort really goes into the work that we do. And for a lot of us, Charity Navigator included, and I looked at BA, I looked at your roster too, we don't have like hundreds of people working behind the scenes. We're actually doing a lot with a little. So that everyone's aware, obviously if you're just joining us and you're not quite, you don't quite understand like what's going on, today is actually Giving Tuesday, but it's also Day. And Giving Tuesday was launched in 2012, so it's been years. It was actually launched in New York City by a school teacher that taught in the Bronx, and he wanted, I'm sorry, I need to take that back, 12. So it's been 8 years. And so for a lot of people, they don't realize that it's a global day of giving, even though it was launched in New York. It is not just a national day, it's a global day. And it does take money to make these things happen. So that's why you see a lot of activity today on Giving Tuesday in terms of fundraising for a lot of nonprofits. Jump over to blackaids.org to support them financially, because the work does take funds. But talk about your donors. What do they like? Do you see new donors have come into the fold this year? Have you seen your what I call your legacy, like really kind of sticking with you? What has it been like?
You know, this year has been such an interesting year. We've had a donor base that has consistently been folks who are impacted by HIV, living with HIV, that really give in memory or in legacy of someone. But this year, and with the summer of uprisings that we've seen, the individual giving in particular has grown dramatically for us, which, you know, is a really exciting thing. And it's also an interesting thing to happen in the middle of a pandemic. and inequity. And, more, we are not going to tolerate, we're not another 400 years of. Stacey? Yeah? Am I frozen? Yes? I can't hear you, Stacey. Somebody in the chat, let us know. Can you hear us? Can you hear me? Can you hear Stacey? I'll keep going. So for us, we've seen this increase over the summer. Can you hear me, Stacey? I can't hear you. And I don't know if anybody can hear me. Dowd said he can hear me, but not Stacey. So Stacey, I'll keep on talking, and then you chime in, because I still have a whole question to answer. All right, so we've had this kind of amazing amount of giving that's happened. And it's really happened, we've seen social media folks post and say, hey, this is an amazing Black-led organization that is doing the work on the ground across the country, and support them. And we see their followers come in and donate. And so really the donations have been, a lot of individuals who are giving $5, $10, $15 at a time. And then there's also been some kind of like amazing spaces that we've seen for donation, where it includes, organizations like for-profit organizations that are coming together and saying, hey, we've heard about BAI, our Black employee groups have heard about BAI and your services, and we want to send you X amount of money. And so for us, it's really kind of changed our ability to do work. A lot of funding doesn't work towards administration and finance and all of the things that happen to make the work happen. And it also has allowed us to, give things to our clients like, transportation, and how do we make sure that they have funds to be able to support themselves during this pandemic. And for us, it's been kind of really exciting. The list of donors we have, and also make sure this is right. I think folks came together this summer and said, okay, we're going to support Black organizations. We're going to support Black leadership. Yeah, they can hear them. But we don't, we're going to try again.